The effects of COVID-19 on the lungs are pretty well known, but can the virus affect the heart? Joining us now from the St. Francis Heart Center at Mercy Hospital is Dr. Sid Yadav. Doctor, thanks for joining us.
Hi, thanks for having me.
So important right now because really since last week we heard the reports of it's a rare side effect, but swelling of the heart in some teenage boys and young men after getting the vaccine. Can you tell us more? Swelling of the heart, what does that mean?
Right. So what we have been seeing is a higher incidence of myocarditis in people who have been vaccinated with the mRNA vaccines, particularly young men. And what myocarditis is essentially an inflammation of the heart, and it can present with symptoms such as chest pain, shortness of breath, or palpitations. But I do want to emphasize, although there was a higher incidence of myocarditis or pericarditis in those people who have received the vaccine, it is still exceedingly rare. Most of those cases were discharged from the hospital, and it appears to be that the risk is relatively low.
When you say rare, really, there were less than 300 cases of this among 12 million doses of the vaccine going out. So yes, extremely rare. Right. But when that report came up, I'm sure a lot of parents got very nervous. Would a parent even know? Is there a symptom? What is a symptom of inflammation of the heart?
So symptoms generally are chest pains or shortness of breath on exertion or at rest, or palpitations where you feel fluttering in your chest. Those are some of the symptoms you would see with myocarditis.
Now, were you seeing the same issue among older patients who recovered from COVID-19?
So in patients who've had COVID-19, especially older patients, they tend to have, they can have residual symptoms, either related to myocarditis they already had while they were infected, or other organ system dysfunction, particularly chest pains, shortness of breath on exertion. These are types of symptoms that can persist more than a month out from the initial infection.
So in general, is there a connection between some heart problems and COVID?
Yes. So when patients have, particularly older patients with risk factors such as hypertension, diabetes, obesity, they can. COVID is essentially a SARS-CoV-2, which is the virus that causes COVID. That's essentially a respiratory virus. Mm-hmm. Now, once your lungs are affected, your oxygen levels go down, and that creates a lot of oxygen demand on the heart, which can cause damage, as well as just the intense inflammatory response that we see in COVID patients. That intense response or cytokine storm that can also cause heart damage as well.
And we've read certain reports too about athletes who had severe COVID, and there were worries about them going back and getting back into a really strong exercise regime. Is there anything about an athlete or someone who works out a lot that they should get some sort of heart screening after recovering from COVID?
Generally recommend in patients or athletes that have had COVID who were asymptomatic or had just had mild symptoms, we recommend no routine screening. However, in patients that had severe symptoms, we do recommend basic screening with EKGs and echocardiograms, which is just an ultrasound of the heart. And then sometimes we recommend the cardiac MRI.
And what about your patients who already you're already treating with heart disease? How does COVID, or did COVID, were they more at risk of the disease because of heart disease?
Yes, there is certainly a higher risk of hospitalization and a higher risk of fatality if they do have pre-existing conditions. If you have a heart that cannot pump as much as it should, uh, or you're already starting with a lower capacity, and then you place an intense demand on that heart, and that would certainly cause heart failure and other complications of COVID.
Now, you're talking to us from the St. Francis Heart Center at Mercy Hospital,
Right.
which launched late last year, so it's relatively new.
Yeah.
Tell us
Yes.
about the care that's available there.
Yes. We're excited to bring the St. Francis Heart Center to Mercy Hospital. We have a brand new state-of-the-art catheterization laboratory, which is where we perform angiograms on the heart. And we use the same exact imaging technologies we have at St. Francis, and we're able to take care of cardiac emergencies as well as elective procedures. And we're certainly pleased and excited to bring this exciting technology to the people of Rockville Center.
Now, your staff works with the center that is in Roslyn. You all work together.
Yes. Yes, the patients that come through the St. Francis Heart Center at Mercy, they obviously still have access to the world-renowned surgeons at St. Francis as well.
And tomorrow, you're hosting. Actually, you're part of a Men's Health Month webinar. You have a little bit more information on that?
Yeah, so tomorrow we're going to have a discussion pertaining to men's health with some interesting topics such as the prostate, sleep apnea, orthopedic problems, as well as COVID-19 effects on the heart, which I'll be speaking to specifically.
Extremely important. And we have a number for everybody if they want more information on the webinar, which is tomorrow, 6 p.m. Am I sure? Correct?
6 p.m.
Okay, at 6 p.m. And the number for anybody who wants to get involved with, like you said, some very important information is 516-520-2500. Doctor, thank you so much today.
No problem. Thanks for having me.